will start now with Professor Frederic Atoama. I don't know if he's in this meeting. Professor Frederic? Hello, Frederic? Rich? Professor Frederic, you are here? Okay, Professor Doku?
So I'm here.
Jones Kwame Hene is here.
Yeah, I'm here.
Professor Doku, how are you?
Fine, thank you.
Thank you very much. Where is Professor Ama?
Professor Amma, I think he will join soon. I guess he's just having a challenge joining. Now let me try to reach him because we spoke about this meeting today, so he's very much around.
Okay, before that, I will give you to everyone the agenda for this meeting. We will have a welcome opening remark from Professor Frederic Atoama, who is the PA of CHINNOVA project. And we will have the remark from partners, which will give you by Dr. Nadine Liangi. Dr. Liangi, you are here?
Yes, I'm here.
Okay.
Thank you.
After Dr. Nadine, Professor David Doku will give the introduction to the CHINNOVA project and the call for proposal. Dr. Sidi Salak will talk about the eligibility criteria, who can apply and what expected. And myself, I will present the EDSC protocol and compliance requirements. Mrs. Georgina Manson will give us application procedure, deadline, and submission timeline. After that, we have Professor Calpil Julien for the question and answer first session. And Professor Doku will come again for the next step. And we will close with Dr. Makumba for the closing remark and the group photo. Professor Frederic Ama, you are here? No? Okay.
Yes, thank you so much.
Okay. Yeah. You have the floor for 5 minutes.
Thank you. Good day, everyone, from wherever you are. It is definitely a pleasure to be here. We thank you so much for taking time off your busy schedules to be with us during the first information session on the CHINNOVA project. I'm sure within this time that we have stipulated for the purpose, most of the questions that you have lingering will be answered. The CHINNOVA project, as you know, covers West and Central Africa. And here we are looking at the nexus between climate and health. We are also interested in innovation in West and Central Africa. Over the last few years, we know it is clear that in West and Central Africa, issue about high quality data that is in the climate and health domain that is useful for decision making is a challenge. And we are using this particular initiative, which is sponsored by the UK Foreign Commonwealth Development Office and then the IDRC Canada, to really address some of these issues on the continent. The goal is to ensure that we have a wide array of stakeholders that are involved in the knowledge generation and knowledge application process. So here we talk about academia, civil society, policymakers, and then communities that are end users of the knowledge products coming together to craft solutions that are innovative when it comes to the nexus of climate and health. So in this time that we are meeting, we believe that it will be a useful learning experience for all of us in terms of what the project seeks to do. So feel free, when the time is up, ask any kind of question that you have. We've also tried to consolidate some of the potential questions into a frequently asked questions session, which will then be deployed on the system that you can always engage with. Beyond that, if there's any challenge, you can still reach out to the email addresses on the link, and then your queries can be answered. I want to seize this opportunity to thank the consortium partners, particularly the Association of African University, IPCI, Institut Pasteur de la Côte d'Ivoire. I want to thank you. We also want to thank WASCAL, West Africa Science Service Center for Climate Change and Adapted Land Use, who are also an intrinsic component of the consortium, and then University Omar Bongo in Gabon. So you can see that from the consortium, we have partners in both West and Central Africa. And of course, the AAU is continental in outlook. So thank you so much for coming. And may we have an interactive and interesting session this afternoon. Thank you very much.
Thank you very much, Professor Amma. I have a comment from one of the participants who said that the meeting should be in French. The meeting is both in French and English. We talked here about equity. Myself, my presentation will be in French, but for the question, and you can ask your question in French, and I will see with the team who we can share the presentation with all of you, both in French or in English. I will ask Dr. Nadine for the remark from partners for 5 minutes.
Thank you very much. Bonjour à tous et bienvenue aux candidats au premier lancement de l'appel.
Thank you very much, and you're welcome to this first session, which has to do with CHINNOVA. As a new partner of the new project, the University of Omar Bongo is honored to represent partners of this project. I made mention the Center of International Research of Canada, the Ministry of Foreign Affairs of Commonwealth of UK, which are our two main funders, and equally the Association of African Universities of West Africa and Central Africa, and also WASCAL, an Institut Pasteur of Côte d'Ivoire. The climate and health have complex relations in terms of civilians. When it comes to they help us to reinforce capacity, and a lot of us are in difficulties as well. This initiative is not isolated and sincere in terms of health sector. She equally helps to identify competent researchers which can propose concrete solutions which are pertinent and adapted to the problems of our health systems. But this opportunity equally helps us to bring together all this research and share their experience so that they can help all of us.
Le climat et la santé. C'est donc un véritable défi pour les équipes.
So it's a big challenge for the teams.
Tous les potentiels candidats qui sont connectés.
For all the potential candidates who are connected this afternoon, they are already working on some issues in terms of climate change and their health. We hope that we are going to have a very rich session, and every team would be able to know how to go about presenting their proposals, which could benefit the CHINNOVA project. We have 10 projects that we can actually finance, and thanks for the CHINNOVA team, and I wish all the teams good luck in this project. Thank you very much, Dr. Nadine. I would also like to mention to Francophones that there's interpretation ongoing, so you just have to locate that on the globe and choose the language that is convenient for you.
Thank you very much, Dr. Nadine. There is a translation, French, English, English to French. I think you can have this translation from your computer. And when the presentation is in French, you can translate in English or English to French. Okay. Professor David Doku, you are ready for your presentation? Okay. You have the floor, Professor David.
Thank you very much. I hope, and I want Professor Andre to answer. I hope you can see my slide. Professor Andre?
Yes, we see your slide.
Okay, wonderful.
You can go ahead. It's okay.
And let me try to show my face for a while, and after that I can take it. So I want to add my voice to Professor Sama and our colleague to welcome you, and of course the chair, Professor Andre, to welcome all of you to this important information session for our call for proposal for funding in the area of climate change and health. My presentation will be about 10 minutes, and to cover these areas, introduction of the act, and I will talk about what it is, and then the CHINNOVA project, our call for proposal now, objective of the call for proposal, our research questions and priority areas, and some expected outcomes. My colleagues will fill in during the question and answering time. So if there are things that are not clear, just jot them down and we will come back to them. So the act, sorry, I think there's something messed up here, stands for Advancing Research for Climate and Health. ACT for short. It is an important regional climate change, regional and global collaboration that is aimed at addressing the nexus between climate change and health across mostly low and middle income countries. So it's a global partnership that focuses on the health impact of climate change. It is co-designed and jointly funded, as my colleague has said, Canada's International Development Research Center, IDRC for short, and the UK's Foreign Commonwealth, FCDO for short also. And the total committed investment for this is about 27.2 million Canadian dollars. We don't have all the ports with us, and I'll explain. This is structured as a 5-year partnership, approximately, and to build an actionable evidence base at the intersection of climate change and health. So, CHINNOVA, which we are going to talk about briefly, is one of the advancing research for climate change and health networks. So what is the aim of ACT? Is to generate robust, regionally relevant evidence on how climate change affects health systems, disease burdens, vulnerable populations, and health system resilience. And it's also aiming at strengthening the research capacity, especially in the global south, and support local and regional leadership in climate change and health research. There are 5 regional hubs located in West and Central Africa. That is the first one here, as you see on the slide in green, is CHINNOVA, which I'm going to talk about briefly in a second. So there are 5 hubs that form the arch, and CHINNOVA is one of the 5 hubs. Then we have Latin America and the Caribbean. They have what they call the climax. And then we have the Middle East and North Africa, which is acronym MARCH. And then we have Eastern and Southern Africa, which is acronym ESA. And then we have the Asia, including the Indo-Pacific, which is the acronym for their hub is called REACH. Now I'm going to zoom on CHINNOVA, which is why we are here. So this is a map of how they spread. Climax is here. Latin America, CHINNOVA is West and Central Africa. ESA is in East and Southern Africa. We have MARCH in the Middle East and North Africa. And then we have REACH in Asia. So you can see it's a global network for major climate change and health research hubs, mostly across low and middle income countries, or so-called global south. About CHINNOVA, few words. CHINNOVA, its location, name, location, and institutions. CHINNOVA is an acronym that we couch from Climate Change and Health Innovation Hub for West and Central Africa. So CHINNOVA simply stands for Climate Change and Health Innovation for Climate Change and Health Innovation Hub for West and Central Africa. And then the institutions, as the PI gave the remarks, include Association of African Universities, which is the lead institution here located in Ghana. Its headquarters in Ghana, but it has member universities across the entire continent, over 400 member universities. Then we have the West African Science Service Center on Climate Change and Adapted Land Use, WASCA, which is headquarters in Burkina Faso, with offices across the West African region. And then we have Institut Pasteur, Côte d'Ivoire, IPCI, which is located in Côte d'Ivoire. The chair of this information session is based on that, and that institution. And then we have Université Omar Bongo, based in Gabon, which is also a key partner. I am nested with the AAU on this call. So the CHINNOVA projects involve Central and West Africa, and we have 17 countries in all, Benin, Cape Verde, Chad, and all of that up to Togo, which you can see on the map. So the project is supposed to cover countries within the West and Central Africa. Functions of CHINNOVA. CHINNOVA is aiming at facilitating knowledge creation across disciplines and countries in the areas of climate change and health, building research capacity and leadership in climate change and health, supporting evidence-informed policy and practice, strengthening the resilience of health system, and this is very key, resilience of health system and communities to climate risk. And on the basis of that, we intend to fund 8 to 10 collaborative research and innovation projects over an 18-month period, starting from 2026 across to 2027. So to be able to achieve these 4 broad areas, this call is rolled out. So the call for proposal, we have 2 calls for proposal. Now we are dealing with call 1. The first call for proposal, as I just mentioned, is aimed at funding 8 to 10 collaborative research and innovation projects over an 18-month period. The call was launched on the 9th of October this year, this month, and we aim to close the call by the 15th of November. The second call will be launched in February or March next year. And that core is also aiming at funding collaborative and innovative projects which will be implemented over a 24-month period from 2026 to 2027. I will not talk about the call for proposal number 2 any more. From here, I will talk only about the first one, which is why we are here. So the first call for proposal is expected to reflect interdisciplinary and cross-sectorial collaboration. Is looking at integrating gender and equity consideration in climate change and health, demonstrating strong contextual relevance to the realities of West and Central Africa. And then we looking at the core, a proposal that should outline clear pathway to impact, should engage stakeholders in its creation and implementation as much as is practicable. Then a long-term sustainability should be the focus, even though the project itself is for a short period, 18 months, but we expect to see a path, so dot connecting to the possible sustainability of whatever project we are seeking to initiate. Then it should produce evidence base that informs policy in its own right to a large extent. It should strengthen institutions and build climate resilience health systems. So 8 to 10 projects will be funded. Altogether, $700,000 US, but each project will not exceed $70,000 US. So $70,000 US is the highest, the ceiling. It doesn't mean that all projects should go to the ceiling. If your project by your deliverables and activities will be $50,000 US, ask for that, but you can't go beyond $70,000 US. I'll highlight briefly, and one of my colleagues will talk about the geographical scope. As I mentioned earlier, we are looking at 17 countries, and these applicants should be, the lead applicant should be having his or her primary affiliation to an institution in any of these 17 countries. And the research should be conducted in these countries. Funding will not be given to countries that are outside these 17 countries in the West and Central Africa. My colleagues will highlight a bit more on that. The objective for this core one, this particular core, we are seeking to generate robust contextual relevance evidence on the interaction between climate change and health in West and Central Africa. We're aiming to pilot and evaluate innovative solutions to enhance climate resilience, health system adaptation, and community well-being. And we're looking at strengthening the capacity of African research institutions and their partners to lead and sustain climate health research agenda. So we want to build the capacity of African scholars, young, intermediate, late, advanced scholars in the area of climate change and health. And not only that, but also with their partners. We're aiming to build collaboration across sectors, disciplines, and countries to create knowledge, accelerate learning, and scale up effective approaches. So there is also a possibility that some approaches already that are working could be tested and scale up, or this could provide seed money for testing the proof of concept, which in the future could be scaled up and used. So our research questions and priority areas. First, these research questions and priority areas were co-created through stakeholder consultative meeting. Two of them, one was held in West Africa in Accra and another one in Central Africa in Gabon in May and June this year, respectively. We brought together key stakeholders who are knowledgeable in the area of climate change and health to think about what areas are feasible and what areas has the potential to influence policy and practice. And it allowed us the opportunity to facilitate dialogue between stakeholders from health, environment, agriculture, disaster management, academia, and policymakers. And then it also ensures that research priorities align with regional developmental strategies. For example, the ECOWAS region, the African Union Agenda 2063, and then, of course, the Global Developmental Agenda, which is the Sustainable Development Goals. The co-creation process also produced a consensus-based actionable research agenda with timelines, responsibilities, and monitoring mechanisms. So we're working as part of it was the co-creation of the research areas. The review of the proposal and orders will be in that same line of partnership with stakeholders on the continent to ensure that what we are funding is really what to contribute, even if in a moderate way, to support the work that is needed to be done on the continent. So the research questions and the priority areas. 6 main research questions and priority areas we are looking at here. Research, health system preparedness and response. So we are looking at proposal that will address health system preparedness and response with questions such as, but not limited to this. The questions are not limited to this. There could be more. How can health system anticipate and adapt to climate shocks? For example, heat waves, flood, drought, dust, and so on and so forth. And what tools and approaches can improve health emergency preparedness and response capacity? Then we are looking at interoperable climate health data system. We have data in silos, and we want the data should be interoperable, that they should be findable, accessible, interoperable, reusable, and so on and so forth. So we're looking at proposal that will address data operability. And then we're looking at climate sensitive diseases and health outcome. We look at seeking to address questions like how are climate variability and change influencing the distribution, seasonality, and burden of vector-borne and waterborne diseases, including but not limited to malaria, for example, dengue fever, and cholera. And then what interventions can strengthen, for example, surveillance and control of water and vector-borne diseases in the context of climate change. The other 3 priority areas are gender, equality, and vulnerable populations. Research that is seeking to address this with respect to the impact of climate change on these vulnerable populations. And then we're looking at climate information services and early warning in early warning and response systems that can enable effective and timely decision making to address the impact of climate change and health. And then last but not the least, we are looking at policy and institutional innovation. So what policy instruments, for example, innovative multi-sectorial response mechanisms and incentive structures can promote and the integration of climate health considerations into training curriculum, for example, for both climate and primary healthcare workforces. So these are the the 6 priority areas that we are seeking proposals to address. Expected
You can go quickly because your 10 minutes is over.
Yes, this is the last slide.
Yes,
So
okay.
we're looking overall that the proposal should be seeking to build climate resilience health system in West and Central Africa. And it could be done through many pathways by reducing gaps in knowledge on climate change and health, improving gender equality and inclusion in climate change and health actions, and showing the impacts of CHINNOVA on network, also building capacity and network across the region. Thank you very much.
Thank you very much, Professor Doku. There are many questions. Don't worry, there is a question and answer session. And if we can't respond to all your questions, we will see with Professor Ama how we will proceed to have, but be sure you will be very happy after this session. Dr. Salak, are you ready for your presentation? Dr. Salak?
Yes, Professor
Go
Andre,
ahead.
good afternoon.
Okay.
Let me quickly share my screen. I hope you can see my screen and can see and hear me.
Yes.
Wonderful. So, look, I'm a Francophone, so it's better I speak in French now. The translator, the interpretation will do its work. Voicing out what my colleague Professor Doku just said, he mentioned, I will maybe repeat some few areas there, but it's important for us so that we get all the eligibility and compliance that is required from the first call that we call a small grants call. Donc, alors, l'une des premières conditions d'éligibilité.
One of the first, the conditions of eligibility and compliance, you must submit online through the CHINNOVA grants management, and the deadline is 15th November 2025, 6 p.m. GMT. And that's the link mentioned. It's very important that we receive your submissions and proposals in their electronic version via these platforms. One of the important things to consider in terms of eligibility and compliance, you need to work around these key thematics areas. I think Professor Doku gave you details. I just want to highlight on some important aspects, these 5 aspects. So we need to focus on gender, equality, inclusion, and vulnerable populations. He showed you some of the research questions which you could work on, but there are many more. I think that when you go to Annex 10 of the terms of reference of the call of proposal, there are many questions, supplementary questions over there that you can also research on. So what are the eligible countries and institutions? It's very important that these countries are listed. Professor Doku gave you the countries: Benin, Cameroon, Chad, Cape Verde, Côte d'Ivoire, DR Congo, Equatorial Guinea, République démocratique du Congo, Guinée équatoriale, le Gabon, Gabon, the Gambia, Ghana, Guinea-Bissau, Liberia, Mauritania, Sao Tome and Principe, Senegal, Sierra Leone, and Togo. There are countries that we classify as high-risk countries in terms of the basic funds. It's very important that when they accept call of proposals and they are from institutions of these high-risk countries, So there's going to be further agreements when the projects from these countries are chosen in terms of CHINNOVA and IDRC, so that some points will be clarified. So once proposals are accepted, then we can then send a contract. We're not looking forward to receive proposals from individuals, but from institutions, research institutions, a university or an NGO who are geared towards research and who are established in one of the eligible countries that we've made mention. So another point to also consider in terms of eligible countries, interdisciplinary and multidisciplinary teams. They could be consortium. They must have one leader who can be an academic or a research expert. And you need to demonstrate that working with community-based organizations and NGOs as well. We're looking for consortiums. So the idea is to enable plurality, because when we're talking about climate and health, those are two different activities. There's also an option to include other institutions from country. It's an option. It's not an obligation. An individual may lead only one proposal. He can be only the leader of one, but can't participate in others as a team member. And in the case of a consortium, CHINNOVA will sign only one contract, and in this contract we ensure that the signatures of other members would reflect as well. This is also something that Professor Doku touched on in terms of the funding, eligible cost, and documentation. So we can also ask collaborators maybe to fuse their projects, but we're looking to finance 8 to 10 projects, and we have a total of $700,000. So the first call of proposals in relation to this project is going to be for a period of up to 18 months, starting from January or February 2026. We think that by then we would have signed and completed all the contracts. Personal costs, field work, training, travel, equipment, that are 20% of the budget. Another thing which is very important at CHINNOVA is data. So the collection and data management are also very, and workshops as well. And there are indirect costs that must not exceed 13% of the total budget. And in terms of documentation, we have audited financial statements. If you have some financial statement reports, it will help us to ascertain, as to your visibility, your organizational chart from the HR as well. The procurement, If you have your procurement policy, you can equally share all those with us. Some of your latest technical report, and members of your consortium or participants must sign letters of commitment and CVs of your team members as well, and then your work plan. And at the end, if you have the chance, you're supposed to sign a contract. So these are the eligible documentation in terms of doing monitoring and evaluation. How must you prepare your proposal? They could be submitted in English or French, and you need to go straight to the point. So 25 pages maximum if it's in English, or 30 pages maximum when it's in French. And you need to also highlight on the sections. You can get them in the terms of reference on which sections you are going to focus, but you can equally add some others once you don't attain the maximum of pages. Clearly design your methodology, what approaches are you using. If you have to do sampling, you have to explain the methodology that you are using, and how are you collecting data collection as well. Have ethical approvals as well. And don't forget, we have an annex that guides you to help you to take into account what is gender and inclusion considerations. And Annex 3 is also of great importance. The objectives of the project, and the various phases, trajectories that you need to follow from beginning to closure. So your proposal has to take that into account. In reality, the hub is going to function thanks to your research activities. So there's a framework that you need to follow in terms of monitoring and evaluation, and some training, and try and read the roadmap which is in the Annex 3, so that you get a good idea of what CHINNOVA wants to do and how your proposal is supposed to align in terms of these activities. This maybe not be you need to keep in mind that when you are writing some aspects of your proposals that help you get more marks. So you need to be faithful to the research teams that were identified. That gives you 20%. And the scientific and technical merit also, it's over 20%. If we see whether there's potential for impact and scaling, since you are going to work over a period of 18 months, that also gives you 20%. These are important parts when we're talking about the potential for impact and scaling. And the team composition and expertise need to be very convincing, and then you need to take into account gender equality and inclusion, and 15, which is they are all 50%, and then budget appropriateness, which is equally over 10%, so that you can convince those who are going to consider your proposals. So some important concepts that you need to take into account. I'm repeating myself. They are also considered in terms of the eligibility and compliance criteria. You need to make sure that you submit all the documentations that are requested for. In terms of you can see that in the roadmap of And then we also have an email address where you can ask your specific questions. And then we also have some questions which are frequently questions that you can also on our consult on our website. So you have to at CHINNOVA, we hope to manage knowledge and keep the data. So questions around ethical considerations. If you don't have, you need to consider that and see which international organizations may help you with that. And if you are going to engage humans in your methodological approach, if you are going to administer questionnaires at the level of the population, you need to have ethical considerations which are approved. In all in your various countries, you know how to go about getting all this ethics approval. You need to ensure that we respect the organizational the communities and ensure that the financing that has been given to you is not used to harm people. So you need to respect the words "do no harm," because we're in the field of health. We do all understand this concept. Since we're dealing with climate and health, we want to respect this concept. I think I'm going to stop over here. So I'm going to repeat this slide, which shows the deadline, 15 November 2025, 6 p.m. GMT. So proposals that are going to be incomplete or come after this deadline are not going to be considered. So there's no need to develop a good concept which you can submit on time. You need to submit that via our email in an electronic manner on our platforms. Yeah, they're on the platforms rather. I think I'm going to stop here. Thank you. Thank you very much, Professor Andre. I think people are going to ask you a lot of questions. I believe the next session is me. So also looking for my presentation and share it.
Sorry, hein, je suis en train de chercher ma présentation et puis je vous partage ça.
Excuse, I'm still looking for my presentation, which I'm going to share shortly.
D'accord. OK. OK. Je ne sais pas si vous voyez ma présentation.
I hope you can see my screen now.
Tu peux mettre en mode diapo.
Ouais, c'est ça, je suis en train de voir là, mais il y a le truc qui me ferme là. Minute, hein.
On peut aller à diaporama.
C'est ça, je suis en train de... Moi, je truc. Attends, je reprends là. 2 minutes. Hein.
Mais c'est là.
Je reprends là, rapidement. Là.
I'm going to try sharing again so I can put it in the presentation mode.
Diaporama. 2 minutes. Hein. Yeah.
Are we okay?
Well, I'm working on it. Sorry. Oh, bon. I think I have some little issue with my presentation.
Okay.
Let me try again. Zoom là. Oh, sorry, 1 minute, huh? Okay, let me try again. Oh, no, it.
That's
Well,
fine. I'm waiting.
let's what we will do, I will ask Dr. Miss Georgina Mason to start her presentation, and I will resolve my little issue with the presentation. Miss Georgina?
Wonderful. Great.
Miss Georgina?
Yes. Hi. Hello, everyone.
Okay.
I hope you can all hear me. I am
Yes.
Georgina Diana Mason. I'm a software developer at the Association of African Universities. And I would briefly be taking us through the grants management system we're using. Hello, can you hear me?
Yes, you can go ahead.
Okay. So I'll quickly be taking us through the grants management system and how to navigate it. So I would be sharing my screen briefly. So I believe you can all see my screen.
Yes.
So our grants management system can be found on grants.chinnova.aau.org. And this is our homepage. You have the option of selecting a language. If you want to apply in French, you are allowed to. We have all of these useful pages. So since I have 5 minutes, I would not go in depth into all of these, but you can check all of those out. So this is our grant call page for the English call. You are able to download the call here on the download attachment button. You are able to get some key details about the call. We have the summary information and who is to end for this information session as well. So to log into the grant system, if you could give me a second to hide the spa. So this is the call document that we have available, which I believe everyone has seen and read through thoroughly because it has all the information on what we expect you to provide. So I would be logging in now to the system. And when you log in, this is the view that you would get. This is just a small navigation information portal to show you how many proposals you have submitted. A list of all the recent calls are available here. For English, you choose the second one. For French, you choose the first one. So I would be choosing the English call. Okay, so for this as well, you get access to some key information as to like and the call summary information and the title. And to apply, you click on apply now. If you have already applied, started your application process, then you would update submission. The apply now button would not be available for you. So upon clicking apply now, we see all the various sections of the call available here. where we are asking information on the project information, the project team, the background, approach, methodology, budgets, project management, project exploitation, research attachments, and citations. And you are expected to fill all of these information in. And some key things to note is that you would be asked to input some attachments on your project team members, and your citations would come in at the end. Finally, there will be attachments on the call, so your proposal and all the other key documents, you'd be asked to provide that as an attachment on the research attachments section. So I am unable to move to the next section because I have not filled in any information. You are expected to fill in the project information first before you can move to any of the other sections. But for the other sections, it's not mandatory to move in a linear manner. You can go from ground to project management if that is the information you have available. And you can save and proceed to next. And so you are not allowed to save a section without completing all the required parts. So we advise that you take your time to read through the form, and then you can come back when you're prepared with all your details so you can enter it all in at a sitting. So I believe this is a very broad overview of how the system is supposed to work. I would be available for any questions that would come up during the Q&A section. So I would end here. Thank you.
Thank you very much. Hopefully, I will try again for my presentation. I have an assistant. Okay. You see my screen?
Yeah, please. Can you see my screen?
Hello? Hello?
Yes, we can
Yes.
see.
It's okay. Okay. Thank you very much. We will talk about the EDSC protocol and compliance requirements, ethical standard, data protection, and gender consideration. I will give my presentation in French. Donc, comme Salah l'a dit dans sa présentation,
Salah said in his presentations, there are some eligibility that you need to, requirements, criteria you need to consider in terms of ethics, especially in terms of gender and including, and then data, because they are which are of much of importance to our two funders. So we as CHINNOVA, we need to align based on the directives that they gave us, was given to us. So if you are really going to make use of human or animals, you need to ensure that in your respective countries, you have the ethical approvals from the national institutions that you have in your various country. And you need to demonstrate that you are adhering to the do not harm principles and respect for local communities. So in terms of ethics, for those of us who are experts in research, we have principles that guide our activities. So respect for persons, animals, and the environment as well. So there are aspects that we have to consider, and it should respect the autonomy of the individual before we give our samplings or information. You need to ensure that they are in agreement.
principe qui est assez important.
Another principle that you need to consider.
Donc, qui
So
indique que les chercheurs vont pouvoir,
which has to do with welfare of participants. Researchers should act to benefit or to promote the well-being of participants and should consider the do not harm principle, and then also justice, which is also an important aspect to consider, to treat people fairly, equitably, and with dignity. So you need to ensure that your proposal adhere to all these universal principles. Still in terms of ethics, CHINNOVA is in compliance with fundamental ethical principles and which are relevant to national and international legislation. And other principles that that's protection, anonymity, and confidentiality of personal data. You need to take that into the consideration. So we have already talked about fairness or equity, justice. Still in terms of ethics, participants have their rights. As I usually say, it's not good to force a participant. So that's something that you have to consider. So you, as those of you, you need to implement and consider all these ethical considerations at the national and international level in terms of the study that you want to conduct. There are all things that we're going to consider to take into account before we consider some of the proposals. I've already made mention of research ethics, justice. You need to respect the community, which is extremely important. Confidentiality as well. And IDRC also takes into account anti-fraud. What measures are you going to put so that it's not going to be anti-fraud, anti-bribery, and anti-corruption policies that all employees and grant recipients must follow? And then financial conflict of interest is also something that you need to consider. So IDRC also takes into consideration safeguarding as well. Gender considerations are extremely important by all important. My previous colleagues, So gender equality, recognizing how gender interacts with other identities like race, age, and class. Your proposals must demonstrate how gender equality will be promoted through the project's design and implementation, and your team composition. If you're only men, that's an issue, and if you're only women, so you need to take that when you're composing your team. So impact assessment also, projects need to assess their potential impact from a perspective that recognizes gender inequalities. So in terms of data disaggregation, data collected should be broken down by sex to help identify and address gender imbalances. And in terms of capacity building, any capacity building activities within the project should reflect gender considerations. So some of the questions that you usually ask yourself.
vraiment comprendre et essayer de résoudre des problèmes.
Does your proposal intend to understand and address social and gender inequalities and their underlying causes in the context of your proposal? Yeah, so what are the power structures and power dynamics that exist between men and women and other groups which underpin gender equality? And in the context of your research problem, how is this affected by identities or experiences such as race, ethnicity, socioeconomic class? So when you want to read data, when you are talking in terms of ethnic vs, be extremely careful. They may not be useful in the terms of your analysis. So other questions, these are things that we're going to actually, are going to make these questions available to you. So I've already touched on the good balance between male and female, and then the budget in terms of gender, for gender equality and inclusion activities.
Concernant la protection de données, ça c'est assez
So now
important.
moving on to data protection, you need to consider compliance.
Vos collectes de données doivent obéir
your data collection must comply with all legal requirements at the national and international level. Transparency and consent. How are these data going to be collected? The procedure of collection is extremely important. So privacy also. Data belongs, I usually say data belongs to the participants, and how, for instance, we're going to try and minimize
la fuite de ces données-là. Donc, c'est des mesures que vous devez prendre dans vos proposals.
How are we going to avoid losing some of these data to other people? So data minimization should be considered as well. So in conclusion, what you must take quick, you need to adhere to ethical standards. So this, you need to consider that in your proposals, integrity, honesty, and accountability, and data protection, which is important, such as transparency, consent, and security, and projects must comply with all relevant legal requirements. So this data must not be available to everyone, and then gender considerations as well. So this, what I intended to share with you. When you go on the IDRC website, we're going to share a protocol document with you so that you can refer to that when you're working on your process. So this is in brief what I had to share with you in terms of my presentation. Thank you very much. Are we good?
Okay. Okay. You are okay? Hello? Shini? Hello?
Yes.
You are okay? Okay.
Yes, hello, I'm here.
Yes.
Okay. Thank you very much. And we will start the question and answer session. There are a lot of questions for Professor Doku, for Salak, for Professor Amar, for me also, and we will try to give the correct answer. What I propose, we will take the first 10 questions or 10 people who would like to ask questions. And we have also some questions on the chat. What do you think, Doku and Salak?
Yes, please, let's take that. We take 10.
Okay.
The questions should be very brief, go straight to
Yes.
the point, no background.
Okay.
Just straight to ask your questions so that we can take as many questions as possible. So
Okay.
I would suggest that we take 5 oral, and then we take 10 on that has been asked already. So we
Okay.
take 5, then we take 10. So 5 on the chat from 5 from audio, and then 10 from the chat. We'll go that way and see how fast we can do. But the question you are going to ask, please kindly go straight to ask your question so that we can save some time.
Okay. You have the floor, everyone.
Okay, if no hand is ready, then we can start from the one I can see in the chat.
Yes, go ahead.
Thanks for this. Yeah, thanks for the webinar. Is it a requirement that researchers are linked to a university which is a member of Association of African University? No. No. Yes and no. Yes, if it is a member of Association of African University or not, but is located in West and Central Africa, it's fine. The lead researcher should be based in an institution, not only university, an institution in West and Central Africa, and the research should be conducted in West and Central Africa in the countries we have mentioned. Then we have the other one for the proposal preparation. Is there a full downloadable template of the form that can be downloaded and used before we get to the submission? Ruth, do you want to answer this? Hello?
Ruth? What?
So there isn't a downloadable version of the questions available. However, since we have noted that a lot of people have asked for this, we may incorporate it in the next call. Thank you.
Okay. Yeah, the next question is that can funding be channeled to Canada for the purposes of co-developing technology to be used in the research proposal in West Africa, situation where tech skills are deficient and being sourced through Canadian collaboration? No, the money will not, the primary recipient of the institution that is receiving the money of the institution should be in West or Central Africa in the 17 countries we have mentioned. So we will not fund an institution that is, but the institutions that are located in West and Central Africa can collaborate with other institutions outside the region, but the primary recipient should be a researcher in an institution that is in this region and in the countries that we have mentioned. Eligibility is the United Nations University Institute for Natural Resources in Africa, based in Ghana, be eligible? Yes, but the research should be done in West and Central Africa, and it should be directed to the region. Colleagues, if you have any different thoughts, you can share this.
Alex?
Yes. What are the eligible costs? The eligible costs, salary, subcontract, yes, they are all mentioned. When you go to the website, there's a link that takes you to some what we have stated that could be a suggestion. It's not comprehensive, it's not limited to, but that could be included in the budget. You have it on the link, and you can go there and check. A few more details are presented there. Is there any threshold for a number of applications per country? No. At the moment, no. There's no threshold for the number of applications per country. I believe, however, that in awarding the grant, probably the the evaluators may recommend. We want to award the spread. We want to do the spread as much as possible, but we don't have anything cast in stone. So as many applications can come from a country. Oh, somebody's asking for the recording. Yes, I don't know. The team will decide whether the recording, maybe an edited version can be hanged on the website, so you can play and get it. But amazing if you can do that, you find a refined version that highlights the key issues of the recordings, and that can be listened to on the website. A link to the website. I think that would be very useful. Should all
Yes,
priorities be touched
the
on?
recording would be available on the CHINNOVA website. So
Wonderful.
we would share a link to all participants of this workshop.
Wonderful. Thank you. Should all priorities be touched on, or can be projects on one only? Okay, yeah. So project can be on one only, or you can touch. But normally, the rule of thumb is that if some of the priority areas are cross-cutting. For example, we expect gender, and I believe my colleagues have spoken about in the French version. We expect gender, inclusivity, equity. They are cross-cutting issues. So this should not just be demonstrated in what you are going to do, but even the representation of the team. These things that are cross-cutting, we expect to see some of them there. So yes, it can be focused on one of the 6 thematic areas, but some things are cross-cutting, and we expect to see them across in the proposal. Please, you need a partner with institution in West or Central Africa. Yes. Okay, somebody answered that already.
Okay.
So if you are from East Africa, you are not included. There is a call, as I showed you, ESA is in East Africa. They floated a call. I think, unfortunately, it seems their first call has ended, but I know they will float another one. So on climate change and health. So if you are from East Africa, you may like to look at my slide and then link up with ESA based in Kenya, AMREF. They are taking care of the East and South Africa. Chair, you wanted to say something?
Yes, we will give an opportunity to the person directly of the meeting to ask a question, and we will continue with the chat.
Great.
There is 1100. You have the floor. I can't see.
Yeah, hello. Can I ask my question, please?
Yes,
hello?
Ronald Adamte.
Okay, so this is Ronald.
Yes, you have the floor.
Okay, so bullet 4 in the second presentation, there are some documents that are listed, and I'm wondering whether these documents must all be uploaded. 1, audited financial statement. 2, human resource and financial mandates, procurement policy, latest technical report. So my question, if 2 institutions are partnering, are we saying that both institutions must have their audited financial statements uploaded, and both institutions must have their human resource and financial mandates or uploaded, and procurement policy of both institutions uploaded, and latest technical reports from both institutions uploaded? That is when 2 institutions are partnering. Thank you.
Okay, Ronald, you have a lot of questions. Professor Doku and Dr. Salah, you can give a response before we continue.
Hello, can you hear me?
Yes.
Yes, so these documents, it's necessary you are informed of the need to get them, but they usually come at the due diligence level. So for now, Be convincing in your proposal, but note that they will be required at the time contract will be signed. Awarding of the awards will be granted. So it's already good that you know they are there, and then at the time you will be required to submit them, they should be made available. If you upload them directly together with the proposal, it's fine, but note that they are part of the due diligence documentation.
Let me quickly answer. The second arm of the question was that if there are two institutions, must both institutions upload this document? No. I think the lead institution is the one responsible, and during the due diligence.
It was in Russian hands again.
Steve, could you kindly
The shameful fall of the
unmute
empire,
yourself?
Ukrainian independence. After all that history, Zuka's small Wagner force and a battalion of Spetsnaz Alphas had walked right up and annexed Crimea with a handful of rifles. The Ukrainians and their Western
I think the person who is moderating this meeting can.
It should help us. Yes.
No, it's the person who creates this link. It's roots or I don't know.
Yeah. Hello, can I speak, please? I have a question.
So I'm winding up on that. So yes, so only
men
the lead
everywhere.
institution.
There were times when all one could do was shrug, follow your orders, and check the bank deposits. Zuka considered the Guyana to be one of these.
Roots, can you?
You're there, he groused, kicking.
Okay.
Okay, thank you. Yeah, that's fine. So only the lead institution should submit those stuff.
Okay.
Okay, can I ask my question now?
Yes, she does.
Yeah, thank you, Prof. This is actually a follow-up to an existing question that was answered earlier. It is about the form. So I'm just coming back on it because, preparing a proposal, especially in a team, we need to write a draft and then circulate and ask our team members to give their feedback before somebody can sit on the form at the end and fill out the form online. So if we could at least, even if there's no form right now, could you, the technical team specifically, could you please send us at least the key titles in each page? Because without finishing one page, we cannot move to the next page. That is how the form is working right now. So if you go on the first page and you fill out the things, then you need to save and go to the next. And if you don't finish the first, you don't go to the next. And therefore, it's giving us difficulty to see what is the next question, how much detail is required, what are the word counts required. I think the professors here understand what I mean. So it's always best that we know what is required of us from the page 1 all the way to the last page, so we can actually prepare this in a Word form, share with our team members, have all revisions done before we now sit on the online form and fill it out. So please, we need that one. You cannot put it for the next call, please.
Ms. Georgina, or David Goku, is it possible?
Hello, can I speak?
Georgina, are you there?
Hello, yeah, I'm here. So that request is well noted, but we will check on it because from our end, you can move to the next section without completing it, but we will check on it and provide the questions in a template. Yeah.
Yeah, I think the suggestion I will make is that, Georgina, I think the question was that whether they can download the form and complete it and then cut and paste into the system. So do you have an answer for that? Can they download the form, the template for the application, complete it, and then later they can copy paste the sections into the application form?
No, that can be done. We would include it as part of the attachments.
Okay, great. So yeah, IT will work on that. But if it's not possible, I'm telling from my experience, if it's not possible, what I do is that I go into the system, walk through it, copy the headings, and then put it in a Word, write my proposal. When I'm ready, I copy paste the sections into them. If the provider provides that I'm able to download the form, fine. If not, I copy the headings, and then I work my proposal that way.
Difficulty in this case is
cannot go to the next page to copy the heading without finishing one page.
Sorry?
What would you recommend?
Challenge, that is a smart way of doing it, but the challenge in this particular call is we cannot move to the next page without finishing one page.
ICT people they will check that. It should be possible to move to the next page. So we'll check that. Either that should be possible or it should be possible to download the application form. Thank you.
Right. Hello, can I speak?
Okay.
Roxanne.
Roxanne, you can
Yes,
go
please.
ahead.
Thank you very much. Please, from your website and from the brochure, CHINNOVA is focusing on innovative projects, but then our company, the Technology, will be writing our research proposal based on an evidence-based which transforms climate problems, effective to electricity, smoke, and agrochemicals. Please, how do you infuse our purpose into expectation, being innovations? Question number 2. We have inventions. So when our inventions become needed to solve climate limitations, how are the assurances that CHINNOVA would safeguard our inventions for us? And if so, what are the modus operandi? Thank you very much.
Thank you very much. You have a lot of questions. Okay.
Oui, hello? Hello?
Please, we can hear you.
Okay. Roxanne, could you?
Yes, sir.
Go ahead.
Question number 1, we are asking that from the website of CHINNOVA and from the PDF, the brochure. Now, CHINNOVA is focusing on innovative projects, but our company, we have invented inventions which helps to solve climate problems, respective to electricity, smoke, and agrochemicals. And our question is, how do CHINNOVA infuse our inventions into the expectation?
Okay.
And question number 2, when our inventions become needed to solve climate limitations by CHINNOVA, our question is, how are the assurances that CHINNOVA will safeguard our inventions? And then, if so, what are the modus operandi? Thank you very much.
Thank you, Professor David Doku and Salak.
Can I give it a try?
Yes, go ahead.
Yes, so thank you for these questions. I think you are taking a lead on the perspectives given by CHINNOVA, which is good already. What I will advise here, not really answering your question, because to me your questions are ahead of the call itself, is to look at the terms of references of the call first and see how your innovations fit into the research areas, thematics, but most important also the research questions. That's the first step. The second step is when you submit a proposal in line to that, at the time of signing your contract, we'll make sure that those things are clarified, not before. So if you have an invention that you think you want to upscale using CHINNOVA funding, at the time of when your proposal is accepted and then you're going into the contract signatory, of course, those things will be clarified. What will be the intellectual property rights? What is the modus operandi of safeguarding your innovations, your inventions, and things like that. But for now, we are still away from that question because you are yet to submit the proposal, which is yet to be selected, and therefore you are yet to sign a contract. That is it. There are some questions also written in French. Maybe the chair, when you finish, you can go through those ones.
Prof, before we address the French questions, I just quickly want to address the issue of not being able to access the other section. So during my presentation, I had indicated that you need to fill in the project information tab before you can move on to the next. So as you can see, this project information section has been completed. So it's easy to just click here and move to the next section and have access to the questions and other key details needed for each section. So to anyone that is struggling to move to other sections, please ensure you have filled in the project information. That information is just basic information about your proposal, the title, and your key information. So that should not take too long to get that. Thank you.
Okay, thank you very much.
Thank you very much. Please, I have some just a follow-up to the question. My name is Efas Mensah.
Okay.
On your some of the requirements.
Est-ce que je peux poser une question? J'ai levé la main depuis longtemps.
Some of the requirements in terms of
fini, on va aller aux questions
the financial statement and all those things. I'm trying to figure out whether there are some existing institutions that has already been working with CHINNOVA and some of your partners, AU and all the rest. Isn't there the possibility that because these institutions have already gone through due process and they have some grants being received by these institutions already in terms of the way they go their our grants, the due diligence on their part will be waived so that they will use what is existing as a trump card to be able to hook on onto the platform and run the call as it is. So this is what I want us that maybe if you could look at it, whether it is possible. It's an area that is quite interesting because there are existing institutions who have already gone through due diligence by working with some of your partners. They look at their systems, they have good financial grant practice satisfied and all those things. And so going back for them to ask
I think the question is asked. So let's provide the answer so that we can make progress.
Yes.
So due diligence is case by case basis, but we are giving this general framework so that things don't take you by surprise, as Dr. Salak has said. If you are not able to upload if you are successful, you are recommended, reviewers recommend your work. There are questions that IDRC and FCDO procedurally go through in order to grant you money. It's on case by case basis. So, but these are the generic things that we are recommending that if you have them, you upload them. If you don't have them, you can still submit your work and it will not affect your ranking or your scoring, but they may come back to ask you. So the earlier you prepare, the better. Dr. Salak, am I right?
Yes.
Hello.
You're right.
Okay. No. We will. Sorry. 1 minute. There's a democracy here. Okay, we'll talk about equity in few hours. Donc, celui qui voulait parler, mon ami qui voulait poser la question. Le problème, c'est que comme moi, je ne vois pas les mains.
My friend who wanted to ask the questions, can you go ahead?
Merci beaucoup.
Thank you very much for giving me the opportunity. I want to, first of all, thank the team of CHINNOVA for your various presentations, and which has given us much clear picture in terms of the activities. I want to ask a particular question. I would like to know if an NGO applies, makes a submission, and they have an experience in terms of the research actions, and they have in their teams a lot of university professors. Do they really need to have to also form a consortium? If the NGO already has many lecturers, professors working with them, is it really necessary to go through, put up a consortium?
Merci beaucoup, Ali, parce que j'étais sur ta question tu as mis dans le chat là.
Thank you very much, because I saw your question in the chat.
Attendez, ok, d'accord. Donc la question que vous posez.
So the question that you are asking, I'm going to answer. I think that you are eligible if you work in this field and you are already in association with other universities. It's not a big issue.
L'appel dit bien qu'on peut postuler en tant qu'institution.
You can make submissions as an NGO or an institution. It's very clear. If you apply as an NGO, that is very good. You can lead the activities and invite other people. And if you have the other prefers are going to be as staff. What we want to avoid is that individuals don't apply for make submissions. So if there are, so you have to apply as an institution or NGO. Thank you very much. There's another question. Isn't it important to make submissions via multiple countries? It's not compulsory to do that. Another question that is, can I have access to the complete form? We have already touched on that. Another question is in French. Salak, I don't know whether you see other questions in French and you would like to take them. There's a very long question that is talking about specificity of an NGO in terms of agrobusiness, which is registered in Chad and which wants to develop a consortium with doctors and civilians. What is important is not to apply as a consortium and then share the money to individuals. So when we are considering the due diligence, we are going to take all that in account. And when an individual, for instance, says that he's a staff or personnel from the Ouagadougou hospital, and I mean the funds go into another account. But if it's regarded as a personnel of the NGO, then we know that it helps us to know that it's an operational staff. I think this all what we have in terms of questions. I don't know whether we should give the opportunity.
Hello?
I have a question.
Okay. Okay.
Allô?
Hello, oui.
Oui, allô. Je voudrais savoir, s'il vous plaît,
I
je
have
voudrais
a
savoir.
question.
Allô?
Oui.
Question
Oui,
and
je
answer
voudrais
has not
savoir,
been
est-ce
answered.
que
I would like to know.
aussi le domaine
Yeah,
animal?
I'm asking if
Whether they call for proposals. Please, one person at a time, please.
I am asking if the research collaboration can be done in country. Let's say I can have a collaboration in country, or I have to do it across multiple countries to be eligible.
We answer that question that it's not mandatory. It should be multi-country, but it's recommended. It's like if you have multi-country, well, it's fine. But if it's not a must.
Okay, thank you.
Yeah.
Oui, allô? Ah oui,
Maintenant,
allô?
pour la question que vous avez posée tout à l'heure pour la santé animale, effectivement,
Oui.
Quand on parle de santé, c'est vrai, il y a la santé humaine
So
et il y a
when
la
we are going
santé
to talk,
animale.
we have when we're talking about health, we consider human health and animal health. But in terms of climate and health,
ça veut dire que les animaux peuvent être atteints. Moi, je suis médecin de formation.
it can affect animals. What is ideal?
Généralement, à partir de l'animal, on peut effectivement savoir s'il y a quelque chose qui se passe. Donc, pour moi, si c'est l'animal, c'est éligible. Bon, là, je pense
it's eligible. I think it's eligible if you want to work in terms of the animal sector. Because if there's a pandemic coming, we can get to know through the animals. At this level, I recommend that people read the terms of reference we have all that in the annex, and then based on what we have in the annex, you can take decision. It's just these projects are going to last for about a year and a half. We can have all the ambition, but you also need to be realistic. So you need to stay faithful to the terms of reference, and then you can. The research questions are very much clear and detailed in terms of Western Central African countries. There's another call of proposals that we are going to do in 6 months from now, which is going to consider some other aspects. I've put my questions in the chat, which wasn't read. I'd like to know whether institutions which are members of this project, whether the leader can be there will be conflict of interest if the leader comes from one of the agencies that are into this project. Whether you're from Côte d'Ivoire, Burkina, you can take part. And when you're from the AU circuit, you can take part also as a lead researcher.
Une question, pardon.
Merci bien, merci. S'il vous plaît, on va démocratiser un peu, laisser aussi les anglophones parler. Hein. On a parlé
we talked about equity, so just stay calm, and then we are going to try and give access to your questions. We're still downloading some questions, and then we're going to give you responses. We already answered some of them, and we're still working towards others. Raymond also, you can. Raymond.
You are here? Raymond?
Can we do you have answered mine. Yeah, I have to.
Ramon's question has been answered, right?
Okay. Yes, it has been answered.
Thank you.
Okay. And Jidikel Obame.
Yes, let me give a quick information that some of the questions that are direct and they are on the chat, I am answering on the chat, so they can also check on the chat. Thank you.
Thank you very much, Doku.
Yes, I have a question.
Jidikel.
Yes, thank you so much. Thank you so much for the floor. So just a quick question. I have two. The first is, what is the career level that is required to apply as a lead scientist in a proposal? And the second one would be, what is the maximum number of institutions that can be part of a proposal? Thank you.
Thank you very much. Also, Doku?
The last question, I did not hear it well.
So the number of institutions per proposal.
Okay. So there is no threshold of number of institutions to apply, but the consortium is what we are looking for. Then the career ladder, for now, I think we have not put any threshold there. But believe me, your CV should open doors for you to convince the reviewers that you have the appropriate team, right? This is just between the lines. But for now, there is no threshold of career. Like, it's not compulsory you have to be a full professor to apply, as long as you know you have the right experience to convince the reviewers of your good idea.
Thank you.
Thank you very much, Salak. José Waba. José Waba, for your question.
Oui, merci beaucoup.
Thank you very much.
The first one is, I want to ask if it is mandatory to have a senior researcher in the team of a consortium. And the second question is, I want to know if two NGO can form or can gather together to form a consortium. Thank you.
Salak?
The answer is yes, for both.
Okay.
It's so easy.
Thank you.
Thank you very much, Salak. Mantuzeko Kwaganaba.
Yeah, thanks for the floor. So I have a question that's related to the subject that we will be made regionally. So if I have a subject that's makes the Kenyan country, DRC, the Uganda, I would like to know if I can apply to this call.
All right. So if your institution, your partner institutions are in Uganda and Kenya, they are not eligible. They must be based in West and Central Africa, not elsewhere. Something important again to mention is like you may have your office in Central or West Africa, and then your financial management has to go through elsewhere. That one is not eligible neither. Thank you.
Thank you very much.
So all partners, they must be from the West and the Central Africa.
Exactly, because if you had the presentation done by my colleague, Professor Doku, you understand that the other parts of Africa are also covered. So ESA is in South and Central and East and Central and South Africa, and they have their AMREF call that is open there. You would have applied. This one is for West and Central Africa. So institutions must be from one country out of those 18 countries that were listed.
Thank you very much. Okay.
Sorry.
Yeah, let's go. Go ahead.
So the main leader institution is in Congo, but other partners, they are in those other regions.
Yes, please. But the funding will be streamlined to them, right? The problem is that the funding should not go outside West and Central Africa. This is the problem. So maybe if they can come in without taking any part of the funding, and that can be given another consideration, and that will come from the secretariat, the management of CHINNOVA to decide. But for now, we have to show that everything that every aspect of the funding will stay within the sub-region.
Maybe, yeah, maybe they can be collaborators. Collaborators if they do something and you pay them some per diem or something, fine. But we are not transferring. We are not giving them money as institutions to hold the money. It should be from West and Central Africa. Dr. Salak, does it make it better?
Yeah, thank you.
It's okay. Exactly. Thank you very much. Bamba Sambe.
Bonjour tout le monde.
Good afternoon, everyone. Thank you for the presentation. I have two questions. And the first one, NGOs that are not registered, can they be eligible to projects? And the second one, if you have an NGO which is registered in Senegal.
La deuxième question est plus facile. Oui. La première question, je pense qu'elle est très compliquée.
The second question is easy, and I think the first one is complicated because in terms of NGOs which are not registered, it will be complex. If you are not registered, it means you don't have an identity. You are not recognized by the authorities. That is complex. That's going to be very complex. For an NGO which is registered in Senegal, can they apply for Chad? Senegal is eligible. When you say making a submission, what do you mean? Conducting the study in Chad? Both of them are eligible, so that you don't have any issues.
Oui, bonjour, merci beaucoup.
Thank you very much.
Voilà, merci beaucoup.
Non, je viens à vous. Si une est finie, on vient à vous.
Je vais. Alors, moi, j'ai deux questions.
Oui, allons-y.
I have two questions.
Alors, moi, j'ai deux questions.
So I have two questions, and one of them is in terms of the sampling. You talk about sampling in the call of proposals and the type of methodologies to consider.
De proposer un projet avec un volet quantitatif de recherche. Est-ce que
So can you use,
donc,
if we're using quantitative approaches,
quantitative, elle est impérative pour cette
is that imperative? Is that really necessary to use quantitative approaches? And we talk about
présentation de tout à l'heure, mais en même temps, il y a une des thématiques prioritaires qui porte exclusivement sur le genre. Je voulais savoir comment s'y prendre en réalité. Est-ce qu'une proposition de recherche peut être axée uniquement sur le genre, sans pour autant prendre en compte les autres thématiques prioritaires, tout en sachant que le genre est transversal et que même les autres thématiques devraient aborder leur recherche aussi, en prenant en compte la dimension genre. Merci.
Merci beaucoup, Ndeye. J'essaie de répondre à la deuxième question. Salah va et puis si Kumba est là, la recherche quantitative, elle va répondre. Voilà. Donc, pour le genre, effectivement, il y a une thématique qui est dédiée. Étant donné que, en termes de changement climatique, souvent les désastres peuvent être plus portés par exemple, les femmes ou le haute classe, c'est ça. Mais pour les autres projets, les autres thématiques, quand vous faites un proposal, il faudrait que vous tenez compte du genre.
You need to take account gender considerations, even when you are composing your team.
Le projet va porter exclusivement
so
sur cette thématique qui porte sur le genre, je crois le genre est...
Yeah, so we have one which is focused on gender. So I don't know what I've clarified the issue. So, yeah, it doesn't matter the team you're working on. You need to take about, you need to take gender consideration. If it's only women, we have issues with that. And if your team members are only men, we also have issues. So there should be gender balance. And these are some recommendations from our main sponsors.
Est-ce que je peux venir là?
Oui, Salah, vas-y.
Can I help you?
Merci beaucoup,
Thank you very much. For the first question, you are not obliged or forced. How do I call them? These are when it comes to the methodological approaches, you have to try and convince whether it's quantitative. You need to, if there's a sampling, targeted sampling, you have to convince us in terms of the approach used. We have, these are options that we give to try and convince the evaluator. So it doesn't really necessarily have to be quantitative. So the sampling method, you need to describe that. So now for gender considerations, I don't want to give you a full lesson. We can have two approaches. So we can have work on research issues which are related to considering gender. Or we can also work and take into consideration gender balance in terms of our population. So that's how we have an annex on this point. So all these things need to come out in your proposal.
Merci beaucoup. Merci beaucoup. Merci.
Merci beaucoup. Donc, on va continuer avec le réseau des guides. Kumba, vas-y.
Oui, merci beaucoup, Ndeye.
Thank you very much, Ndeye. Just to complete what my colleagues have said, when we're talking about quantitative approaches, in terms of sampling, we're always considering heterogeneous population. So you don't need to focus on just one woman, but you need to ensure that you are gender balance in all your activities.
Allô?
So,
oui, allô? Oui.
Oui, allô?
Oui, réseau Guinée. Oui,
oui d'accord. Merci, hein, merci beaucoup.
Thank you very much.
Je pense que j'avais déjà posé un certain nombre de questions.
I already asked a number of questions in the chat message. The executive director from Guinea.
Alors, la question que je voudrais
So my
poser,
question,
les autres sont déjà posées par les collègues. Est-ce que c'est possible
is it
de
possible
soumissionner, par exemple, en français?
to make submissions in French?
Voilà, c'est un peu ça.
That's my question.
sur le site, on a dit en français ou en anglais.
On our website, we indicated that you can do so in English or French.
Latifou Mohamed. Latifatou Mohamed.
Hello. Yeah, thank you so much. Yes.
Okay, you have the floor.
Yes. In the presentation or even in answering some of the questions, you said it will be okay to partner. You can have a partner, maybe example in Ghana and then Central Africa. But I'm asking about the funding. Are we supposed to share the 70,000, or they can, your partners can actually also request for a whole 70,000?
Good question.
David is here. I think he already said something. Like that. Yeah.
Dr. Salah.
So the threshold, the maximum you can request is 70,000 for the whole project proposal.
Okay, so if I have a partner, let's say 2 partners in Ghana from different organizations, and then Central Republic, I have 1, we should share the 70,000.
Exactly.
Yes.
You got it.
All right.
Thank you.
Thank you very much. Brandon Boucher.
Docteur Assandé.
Docteur Assandé. Oui, Assandé, tu avais déjà parlé, non?
You had already asked a question. It's now that I want to ask my question. I followed everything from the beginning. It's now that I want to ask my question. Okay, so you can close your video and ask. Turn off your video. We have an institution which works in the context of biomedicine. So we actually produce scanners that we have already promoted.
Par rapport à ce que ces changements-là peuvent entraîner comme des maladies.
So we want to see what other sicknesses can come up. You talk about injuries. Can foundations also take part in the call?
Caractère scientifique, c'est une chose, avoir un mandat de recherche aussi, c'est une autre chose.
Okay, it's we're actually insisting of NGOs or institutions that have a research mandate in the country in which they are established.
C'est enregistré dans le journal officiel. C'est reconnu officiellement.
Yeah, established. That's why in Côte d'Ivoire.
Ok, merci.
Si effectivement vous avez des activités de recherche sur climat et santé, bon.
If the activities related to climate and health and you are officially recognized, that's not an issue.
Juste ne pas perdre de vue le fait que dans les investissements, en particulier du côté équipement,
in terms of investments in relation to equipment, we don't accept more than 20%. Shouldn't exceed more than 20% in that case.
Nous avons fait même le PCT et c'est des travaux qui sont très avancés.
These are very advanced works that we have done, and we have seen that we can treat the animals or cure animals with this equipment.
Donc c'est quelque chose qui est déjà breveté, qui est connu
something that is already recognized, and you want to continue and improve on that. As we said, you can also apply. We want to take other questions.
Okay.
Brandon.
Oui, bonsoir,
Brandon,
bonsoir, messieurs et dames.
Okay.
Oui, voilà.
Vas-y.
Bonsoir, rebonsoir, messieurs et dames, et merci pour la présentation. Voilà. Donc, je suis Zongo pour Richi, je suis le LG de l'ONG des citoyens dans les familles. Nous avons vocation de postuler. Et lors de votre exposé, j'ai remarqué que vous avez insisté sur l'éthique.
Oui.
Je ne sais pas si vous m'essayez toujours, voilà, vous avez insisté sur l'éthique.
Oui.
Chaque ONG ou association doit en quelque sorte l'éthique du pays, donc d'un point de vue national. Donc, moi, ma question est de savoir si c'est obligatoire parce que il y a des thèmes qui ne demandent pas forcément ce genre d'engagement. Nous, par exemple, on a envie de travailler sur le lien entre les changements climatiques et la transmission du paludisme. Le paludisme n'étant pas une maladie, voilà, que l'on doit en quelque sorte cacher les informations. Ça, on va auprès des établissements médicaux. Donc, ces établissements, voilà, ces établissements nous donneront des données avec bien sûr un document officiel. Donc, c'est un peu là d'où je suis un peu bloqué. Est-ce qu'il faut forcément
Brandon, vous êtes de quel
avoir
pays?
l'amont de ces comités où, voilà,
Oui, Brandon, merci beaucoup. Mais tu es de quel pays? Vous êtes de quel pays?
From which country are you in? Must we, in terms of ethical considerations?
Brandon?
Oui, je suis là.
I'm here, so I want to work on a project which is in link with climate change and then malaria.
Une étude, aller récolter des données d'individus pour pouvoir récolter.
If you want to report,
c'est qui? Vous pouvez arrêter vos micros pour qu'on puisse répondre. Brandon, tu m'entends?
Please, the rest close their mics so that we can follow those who are asking questions.
Comme je l'ai dit là.
As I was saying,
comme je l'ai dit, il faudra une autorisation du comité d'éthique.
You need to get an ethical clearance or approvals.
C'est des données d'individus, de patients.
Because there are actually data which are coming from individuals. So let's move to the next person.
Michael? Michael? Bon, Michael is not available. Innocent. Yenyesu Innocent. Denyenu Yelonin. Oui, bon, c'est ça. Hein? Innocent. Bon. Daouda.
Oui, je suis là. Hamide Innocent, je suis là.
Bah oui, posez votre question, vous avez levé la main, ou bien ça.
So go ahead.
J'ai deux questions.
I have some questions.
J'aimerais savoir
I would like to know
quels critères concrètement
what criteria
l'institution porteuse doit remplir au plan
the institution must have in terms of finance. You talked, I didn't really get that aspect when you were explaining. And my second question has to do with ethical clearance, looking at the time that we have to make the submissions, whether we can meet the deadline, because it takes time to get ethical clearance. For ethical, we're not really asking you for the approvals during the submissions. We're going to ask that before we release the funds to you. We need to ensure that the country has given you ethical approvals before you can work with your project. So for the first question in terms of I wanted to leave that question to Dr. Salak to answer.
On a mis une liste là-bas déjà.
So there's a list over there. So reports which have been audited.
Alors, une institution porteuse doit convaincre justement qu'elle a non pas
So you need to convince that you have the experience in terms of managing funds, especially demonstrate that you are transparent enough and independent, and technical reports that show that you also do reports and share them with other people and other documents. It's not during the submission that is necessary. It's when we're going to do the due diligence that we're going to be considering all those. I think now, based on the deadline that we have, this shouldn't be of priority for now. Then, so when we enter the next stage, we're going to ask you these documents in the next stage. We just make mention of them so that you start preparing them. Okay. So that when your project is chosen, it makes work easier for us.
Oui, merci beaucoup. Ma question, c'est par rapport
My question has to do with
consortium.
consortium. We are consortium made up of NGOs, and we focus on research activities. We have academics from the health sector. We have experts in gender activities.
Des enquêteurs, donc on voudrait savoir.
So I would like to know,
nous sommes éligibles,
are we eligible?
En fait, parce qu'on a vu le
secteur privé. We applied because we see that you are considering the private sector, and that's why we put these NGOs, this consortium together so that we can make a submission.
La réponse facile, c'est oui. Vous pouvez
Yes, you can apply. It's important if all the consortium are identified to just one institution, so one institution can apply. That's not an issue. So we propose that if you want to consider yourself as a consortium, so this individuals have to introduce yourself as people that belong to other institutions. Exactly. So we have agreements between the two institutions already.
Bienvenue, Wanga.
Oui, allô?
Oui,
Allô?
oui, oui.
Merci de m'avoir accordé la parole. Je remercie les autorités pour.
I want to thank the authorities for organizing this session. It really helps us to get clarifications to help us to make submissions that would be are likely to be accepted. So I have an issue or question. What's the size of a research team in the context where we want to collaborate with another country, a neighboring country? So I want to know what is the maximum size of the research team?
Je m'inscris dans la logique des autorités, de l'organisation, d'avoir un consortium. Et par exemple,
so for instance,
je dois avoir, en fait, mon institution, mon centre de recherche doit pouvoir.
My institution has to be needs to have how many researchers, and what about the neighboring country? How many people can we consider in our team composition? I already understand your question. I'll try and give you an answer, and the rest can add up. In terms of the composition of teams, there's no limitations. You need to decide at your level. But what I can advise you to do, since I'm a researcher, avoid to put a lot of people because you want to make someone happy. You need to know what role each person is playing, and that needs to be clear, and whether you really need them in your team. Salak, I don't know whether you want to add up.
Non, c'est bon, je pense que tu l'as bien dit, c'est bon.
I think you've answered.
Oui, la dernière question.
The last question. Try to be very brief, because we've gone 45 minutes beyond the time we wanted to close. My last question wanted to know.
C'est de pouvoir solliciter les supports, les exposés magistraux que nous avons suivis ici. Est-ce que nous, en tant que participants, et aussi des candidats potentiels, pouvons-nous avoir l'accès à ces différents PowerPoint? Est-ce que c'est possible que nous ayons ça?
Salak?
Allô?
Salak? Oui.
Oui, la web manager tout à l'heure disait, Messin disait que l'enregistrement sera mis à disposition sur la plateforme. Et donc, les gens peuvent.
So we're going to make available the recordings, and then people would get the opportunity to download them.
Il nous reste quelques personnes, on va les prendre.
We have some few people.
Thank you very much, Richard from Ghana. I want to find out, can two partner organizations submit two proposals led by each?
Okay, David Doku. David Doku. Also Doku.
Hello. Yes.
Yes.
I think it's possible. It's possible, but we have not restricted that, so it's possible. But as I said, mostly we want to have a spread of the awards. So it will be very rare that one institution will get two awards, given the vast nature of this thing. But it's not cast in stone. If you want to enhance your chances, it's a possibility.
Okay.
Dr. Salak, have I?
Salak?
Yes. I think that all we were asking the proponents to avoid is a single PI being PI in several proposals. So, and that one has been stated already, and it's also in the frequently asked questions that is not allowed. Now, if you play the Maradona game of just shifting positions, I think that one may work out according, depending on the pertinence of your idea, of course, in front of the reviewers.
Okay. Thank you very much, Senator Salak. We will take two questions and go to the end of the session. Evrad Mponze. Evrad?
Oui, bonsoir à tous.
Good evening, everyone. Are you following me?
Ok, je suis Monsieur Mpwamze, en service à la direction de la météorologie nationale du Cameroun.
I work in Cameroon at the meteorology department, and so work on provisions,
Et nous collaborons avec
and we collaborate with the Ministry of Health
et le Centre de recherche sur l'eau et les changements climatiques. Nous
in
avons
terms of climate change. We've had a chance.
de coproduction pour élaborer ces informations.
We've created a group.
t'as perdu?
We have lost you.
A eu un coup parce qu'il a eu un coup et s'est arrêté. Et j'aimerais savoir, comme notre direction n'a pas un caractère, bon, des missions scientifiques, est-ce que à notre niveau,
Since we don't have them added to do research, can I take part in this proposal? The answer is yes to your question.
Tu peux porter le projet, c'est vous, on a quand même, hein. Parce que quand tu regardes les partenaires que tu as cités, je crois que
based on the partners that you've mentioned, all these contribute to generate data which is relevant to climate and health related activities.
Oui, c'est ça. C'est exactement.
Exactly.
Donc, on prend la dernière question.
So we want to take the last question.
Kwame Opoku.
Yes, hello.
Ghana.
Yes, hello.
Hello.
Yes, I want to find out for collaboration grants, does it have to be at an institutional level? So do the institutions have to agree, or once the partners or the leads are from different institutions, it qualifies as a collaboration grant?
Thank you very much, Kwame. Professor David Doku Salak.
Yes, so if you look at the letter of commitment must be signed by authorized signatories. This is important because you will be engaging the institutions or getting the institution's engagement. I mean, you'll be engaging your institution, getting the approval of the institution is very important. And you know, sometimes and very often than not, when you are to go through some ethical clearance, institutions are the ones queried, not individuals. But this is important as well. So please don't keep it at your level only. There are some that are more appealing, like the commitment letters being signed by the appropriate authorized signatories of the institution. That will add more value and more convincing.
Yes. So for the lead applicant, you have the institutional support, but for the partners also, do we need to be at the institutional level, or that can be at individual collaborators level?
My default answer will be yes, but of course, this will be treated on case by case. I usually recommend that when we have this type of opportunities, we could let our immediate leadership know about it, and institutional engagement now becomes natural. So that would be my advice to you as well. Thank you.
Thank you very much.
Okay, thank you very much. Thank you very much to all the participants and for the team.
Vous avez une question?
Oui, Velas. Oui,
la dernière.
Velas.
Oui, excusez-moi. Juste savoir, il y a différentes.
I would like to. There are different research areas.
Uniquement une thématique que l'on doit choisir.
Must we focus on one, or in maximum, how many research areas can we use? There are no limitations. There are no really exactly. One or several. If you can cover all the 5, that will be perfect.
Merci, thank you very much to everyone. I will give the floor to Professor David Doku for the next step. Professor David Doku. Before the closing remark. Professor David Doku.
Okay. Unique, hold on. Okay, I'm trying to upload one tiny bit. Okay. Thank you very much, Chair. So we want to sincerely thank all of you for joining this. What is the way forward? On the 15th, the call will be closed. And then we are hoping to review this by our independent experts and our advisory committee made up of very distinguished persons working in the area of climate change and health, not only in Africa, but across the group in December. And then we will have the selection and the due diligence, selection of the awardees, up to 10 maximum. and then due diligence will be conducted. We're hoping that we should be done by 12th of January, and then the commencement of the implementation of the project will be in February 2026. So on the website we still have a Q&A sessions. As more and more questions come, we update those sessions. So please feel free to go to the website, and any update will be posted there. Also feel free to email the contact on the website if you need further clarification. I have answered a number of questions that have been typed in the chat. Most of the English ones I've answered them. May I ask our IT persons to just extract them before they close? Extract them somewhere before they close the call. So, Chair, thank you very much.
Thank you very much, Professor Doku. Professor Makumba.
Oui.
We want a closing remark and group photo. Closing remark from your side.
D'accord. Merci beaucoup.
Thank you very much.
Mesdames, Messieurs, chers collègues.
Ladies and gentlemen, chers colleagues, chers partners.
Permettez-moi, en clôturant cette session
Dear
d'information,
partners,
d'exprimer notre
permit
sincère
me
gratitude
to
pour votre présence,
bring this to
votre
an
attention et
end.
surtout
We
l'intérêt
really
que vous
want to
avez porté à
thank
cette
you
initiative.
for participating in these
Nous
activities and
espérons
your
que
interest
cette
in
session
this
d'information vous
initiative.
a permis de mieux
We
comprendre
hope
les
that
orientations
this
stratégiques ainsi les critères
session
de
has helped you to know the criteria you need to and requirements in terms of eligibility.
Cet appel s'inscrit dans un moment
And
crucial
this call for proposals comes at a very crucial moment
les liens entre climat et santé.
where the interactions between climate and health.
Vous êtes muté, prof.
Je suis muté.
Non, prof Makumba.
Ton micro est fermé, on
Yeah,
t'entend
yeah. Prof, you have closed your mic.
C'est bon maintenant? Oui. C'est bon.
Je suis désolé. Hein.
Sincerely sorry.
Donc, je disais, en fait,
So I was saying that
permettez-moi, en fait, en clôturant cette session
allow me
d'information,
to close this session to express our sincere thanks for your presence and following and the interest that you have in terms of these initiatives. We hope that by this session of you have clearly understood the criteria in terms of eligibility. So this call for proposal comes at a very crucial moment in terms of the interactions of climate change and health. We need rigorous research. So today we want you to put your ideas together and your various partnerships to bring solutions. It's not only to finance projects. So to get people to come with durable solutions. I want to talk about the collaborative aspect in we can't get all that by one actor. Yeah, please, can the rest mute? It's very difficult. So together we can reinforce resilience and so this session is just about the first step. So we're encouraging you to respect the criteria and submit your proposals via our website. Thank you for your initiatives and engagement in terms of climate change and health to try and get durable solutions to all issues affecting us. And I would like to thank CHINNOVA.
Thank
Thank you very much.
Makumba. Thank very much to all of you for your participation. I think it was a big success as we have 275 participants at yes, it's a big success. Thank you very much. We will go to take the group photo. Makumba, how we will proceed? Chacun met sa photo, c'est ça? Makumba, tu t'es muté encore, hein?
Vous êtes muté.
Makumba, how are you going to go about? I think that you can all turn off your cameras so that we can take the group photo.
Everyone should open his camera. We'll take a photo. Group photo.
Please open your camera. We are going to take a photo. The final picture.
Ouvrez vos caméras. On va prendre la photo du groupe. Oui, moi, je vous ouvre. Hein. Je pense qu'il y a la possibilité.
Moi, je ne m'appelle pas Frédéric Etiao, hein, c'est mon collègue.
Ah ouais. Donc, allons-y, ouvrez les caméras. David Doku, open your camera. AAU. Michael Tufu, open your camera. Maison haute. Ah, maison haute. Je sais pas. Hein? Bilomba Mpunga. Sefa Saye Mesa. Can you open your camera? Pauline, also. And many persons. And Joshua Lantomé. Jennifer. Jean-Luc Sélange, ouvre ta caméra.
Chair, it depends on where they are. You don't want to see something.
You are right, David. It depends where you are. OK. C'est bon?
Normalement, c'est Lydia qui s'en occupe, je pense.
C'est qui ça, Ruth?
Lydia Niam, c'est elle qui s'occupe de prendre la photo de groupe.
Mais est-ce qu'elle est là? Lydia, you are here?
Oui, elle est là.
OK, donc Lydia, tu es là.
Elle est là.
Donc je te laisse la parole.
Let me get the photos.
Personne. Ah, c'est elle
Thank
qui est maison.
you.
OK. Personne,
Merci beaucoup tout le monde.
Okay.
We're able to get all the photos.
Okay.
So we can close and proceed. So I'm handing back over to Vandre.
OK.
C'est bon?
Oui. Aladji Al-Bekarim.
Merci tout le monde. Bonsoir.
Bonsoir, ça va?
Bonsoir, merci beaucoup. Au revoir.
Thank you very much, Chair.
Merci beaucoup.
Okay.
Merci.
Thank you very much.
All potential applicants, we
beaucoup.
wish you a very pleasant.
Thank you very much and a good night.
Thank you. Bye.
Bye.
Thank you. Thank you.
Thank you.
Appreciate. Look forward to future partnership.
S'il vous plaît, ceux qui sont intéressés par les partenariats, je laisse un message dans le chat.
Bye-bye.